Hello, everybody. This presentation is about the protocol of reversal of Alzheimer's disease. This protocol is after Dr. Dale Bredesen. The agenda of this presentation. For whom this presentation? This presentation is intended for regular people and also for doctors who need to know this protocol. Who is Dr. Bredesen? Then I will talk about the limitations of the conventional treatment approaches to Alzheimer's disease. Actually, it is approach, not approaches. The current treatment approach, whether it is successful or not. Then how Alzheimer's disease happens. The drivers of Alzheimer's disease, the mechanisms behind the development of Alzheimer's disease. This is what Dr. Bredesen has discovered. Is Alzheimer's disease a hereditary disease? Then the types of Alzheimer's disease, because Alzheimer's disease is not only one type. It depends on different causes and different risk factors. So I'm going to go through the diagnosis, the type, how to diagnose each type, I mean identification of each type, and treatment of each type. Then I'm going to talk about the cognoscopy, which is the battery of blood tests or the tests needed to identify these causes, the risk factors. Then I'm going to talk about additional treatment measures and the important supplements that the patient needs to support the brain, and at the end the take-home messages. This presentation will be quite long, so I need you to prepare paper and pen and take notes. You can listen to this presentation in parts in order to capture all the important informations in this presentation. Now, who is Dr. Dale Bredesen? Dr. Dale Bredesen is a genius neurologist, and he is director of the Eastern Center of Alzheimer's Disease Research and David Goffin School of Medicine at UCLA Los Angeles, and he is the founder and the founding president and the CEO of Buck Institute for Research on Aging and adjunct professor in UCSF. Dr. Bredesen's laboratory studies basic mechanisms. The laboratories studied the basic mechanisms underlying the neurodegenerative diseases. And he translates the knowledge into effective therapeutics for Alzheimer's disease. When I say effective therapeutics, means therapeutics that can stop Alzheimer's disease or reverse it. Also, that benefits other neurodegenerative conditions, which has led to publication of over 200 research papers. He is the principal investigator for the Alzheimer's Disease Research Center at UCLA. This is the minimum. He has so many activities also in the field of research. Now, this is the start of the presentation. What are the limitations to the current conventional treatment approach? Dr. Bredesen said, as an example, Alzheimer's disease is not a pneumococcal pneumonia. Pneumococcal pneumonia, which is the chest infection that happens due to one organism called pneumococcus. The chest infection or any infection happens only by one cause, by one microbe. But Alzheimer's disease, he found that it's not only one cause that leads to Alzheimer's disease. There are many risk factors working together in order to impact the brain function, in order to shrink the brain. This is what we are going to explain in the next minutes. Also, doctors now, when the patient visits doctor, he requests some blood tests, very limited to the TSH, which is related to the thyroid function, and vitamin B12. We will see now that because of many risk factors, we need to do many investigations in order to know what causes Alzheimer's disease. We treat the patient currently with 2 or 3 medications at maximum, the donepezil and the memantine. We give all the patients the same treatment. So treatment is not one size fits all, because each patient has different sets of risk factors. We need to identify the risk factors that happens in each patient, which differ from one patient to another. Also, the treatment that's currently used give a brief period of benefit, like 1 or 2, 3 years. After that, these medications will not bring effect. However, the side effects of this treatment starts to appear. And in the end, we need to stop these treatments because it will not bring any more effect. So we treat without understanding the underlying pathophysiology or the mechanisms that lead to Alzheimer's disease. The patient appears very late. Usually, the disease happens in these stages. There is one stage, we call it asymptomatic disease stage, which occur between 30 years and 60 years. So during this period of time, which is at approximately 20 years, the Alzheimer's disease started to happen in the brain already, before any symptoms appear. Then the patient go into the next stage, which is subjective cognitive impairment, when the person himself starts to feel that he has brain fog or has forgetfulness. However, when he go to the doctor and do tests for his cognitive functions, it comes normal. So the doctor reassure the patient and say to him, "You're okay, don't worry." Then we go into the third stage, which is mild cognitive impairment. During this phase, the patient still complain of cognitive problems, and when he do the test show defect. Now he start to have cognitive impairment at objective state. Objectively, because we are testing, we see defect in this stage, which is mild cognitive impairment. Notice that the disease starts by the age of 40 already, and now he is 60. Start to complain of forgetfulness from 60 to 65. Then after 65, he will start to complain and go to the doctor, and the doctor find the defect. So how many years passed from 30 to 65? Almost 35 years. The disease is active, and the patient and the doctor, both of them are not aware that the patient brain is already deteriorating. Then we go into the stage of dementia, when the patient start to lose his independence and needs somebody to take care of him. Unfortunately, we diagnose the patient at this stage. We don't see the patient in the previous stages. So the patient present very late, when the brain, most of the brain tissues has already been destroyed by the disease. What we need is we need the patient to appear early, especially if you have somebody in the family, like father or mother, has the disease, because this protocol can prevent occurrence of the disease if you are one of the people who are going to get affected by it. So usually the patient appear very late. So in this protocol, we recommend that people appear early, by the age of 40 or 45, to do some blood tests to know if there is a risk for Alzheimer's disease or not, and especially for children whose parents have Alzheimer's disease. So the children don't go into preventive program, because this program will work only in these 2 stages, in the subjective cognitive impairment and mild cognitive impairment. If the patient go into the stage of dementia, there will be improvement, but it will not be similar to the improvement that happened in the earlier stages, which can be completely reversed. The usual decline in the cognitive test assessments, or the scales we use to assess the patient cognitive function, decreases by 3 points every year. What is the importance of this point? In Alzheimer's disease, if we use a scale like mini mental state examination or MoCA score, the score is 30 in both of them. So every year the patient lose 3 points. It will become 27, and the next year it will become 24. So this is the normal deterioration. The importance of this point is when we implement the protocol, we find that this rate of deterioration is not as severe as this. We will find the deterioration rate start to reduce and probably normalize and become 30 again. The new medications, which are immunologic treatments like lecanemab or donanemab, these are monoclonal antibodies or immunological treatment. This is the latest treatment of Alzheimer's disease. This treatment depends on binding to the protein that precipitates in the brain of Alzheimer's disease patients and try to clear this protein from the brain, because the researchers believe that this protein that precipitates in brain of Alzheimer's patients is the cause of the problem. However, Dr. Bredesen discovered that these proteins are protective to the brain. So when we remove the protection from the brain will become more prone to insult. However, these treatments reduced only the rate of deterioration. The first one reduced it by 22%, and the next one, the recent one, the donanemab, reduced the rate of deterioration by 32 to 36%. But it did not improve the patient. It only reduces the rate of deterioration and did not improve the patient on the long term. Also, it risks hemorrhage in the brain because it attaches to the protein and detaches it from its place. That's why there is risk of hemorrhage. And some patients deteriorate after using this treatment. Now, what is the secret? How Alzheimer's disease develops? There are two main mechanisms behind the development of Alzheimer's disease at the pathophysiologic level or at the cellular and genetic level. This is what Dr. Bredesen discovered and which was not known before. We know the gene of ApoE. Alzheimer's disease has approximately 50 or more genes affecting the way the Alzheimer's disease develops. However, the most important gene is ApoE4. ApoE4, if you have two copies, because we take one copy from the mother and one copy from father. So if both of these copies are ApoE4, you are at 50 to 70% to develop Alzheimer's disease. But if you have only one copy, like one copy ApoE4 and the other copy is ApoE3, your risk of developing Alzheimer's disease is 30%. And if you don't have any copies at all, you still have risk 9%. Now, why the people who have two copies have 70% risk while there are still 30% will not get the disease despite they have two copies? And the people who have one copy, 30% of them will get the disease. This means 70% will not get the disease. And why people who does not have any copy still have risk of having the disease? This is very important point. It has been found that this ApoE gene is a pro-inflammatory gene, that it interacts with REL-A related to NF-kappa B. For non-doctors, the NF-kappa B is the pathway of inflammation in the body. So the gene augments or make it strong. It augments the inflammatory pathway and promotes the process of inflammation in the brain. This means if you have brain inflammation and you have this gene, the process of inflammation will stay longer than the person who does not have ApoE4. If the person have ApoE2, two copies, this means if inflammation happen, it will resolve very quickly. But if you have ApoE4, this means the inflammation will stay longer, probably years, without getting resolved. Why this happen? Because this gene, the product of this gene ApoE4, enter the nucleus of the cell and shut down another 1500 gene. These 1500 genes are responsible for calming down inflammation. So if you block and shut down the genes that are responsible for calming down inflammation, the result is inflammation will stay longer. One of the molecules or just the genes that turns down inflammation or calms down inflammation is the 31. 31 is the gene for longevity. If the 31 gene is active, your health becomes better and probably you live longer. And this 31 gene is activated by resveratrol, which is derived from the wine, the red wine. So, in conclusion, the ApoE4, it enhances the process of brain inflammation and keep it for longer time. Also, there is protein. The protein characteristic of Alzheimer disease is called amyloid beta or AB. The presence of this ApoE4 will not allow the brain to clear the amyloid beta from the brain, because this protein should be cleared regularly by different mechanisms in the brain. If you have this gene, this protein will precipitate and the brain cannot get rid of it. So what triggers this gene? We all know that we have genes which are obligatory. Obligatory means it must work, like the gene for your eye colors. If your gene of eye colors is green, your eye color must become green. However, there are other genes which are not mandatory to implement the message that they carry, like this ApoE4. ApoE4 can stay without any activation, silent, not doing anything, and can become active. What activates the ApoE4 is chronic inflammation. This explains why some people have two copies and don't get Alzheimer's disease, because these people does not have chronic inflammation. However, if you have chronic inflammation, the gene will become activated and the process of inflammation will get intensified. I want only to close the notification okay. Now, the second pathophysiologic mechanism. We have and the receptor of the cell, this is the cell membrane, and we have here a receptor, this one. This receptor is named APP, amyloid precursor protein. This amyloid precursor protein has the ability to get cut, whether to cut in one place here and make two pieces. This is piece number 1, this piece number 2, or cut into 4 pieces here. So if it cuts into these 2 pieces, this is message to the cells of the brain to grow connections and become vital and happy. However, if it cuts into 4 sections, This is a message to the cell to die and for the synapses and the connections to shrink. So if this switch, it's like switch, this receptor is like switch. If it turns to this side, the bad side, the brain cells will die and the connections will shrink. And if it turns to this side, the brain cells will become vital and the connections become rich and stronger. So the amyloid precursor protein is a receptor which works as a bidirectional molecular switch. It can turn to synapse supporting side, this side if it cut into two, or the synapse shrinking side producing the amyloid beta, the protein that precipitate in the brain of Alzheimer patients. Where is this protein? This is the protein. It's one piece of the four pieces that happen if it cut into the bad direction. These four pieces send the message to the cell to die. We call it programmed cell death. The cell has to die. And the severest one of them is this one, the C31. Despite amyloid beta is the protein that precipitates in the brain, but the one that carries the most danger is C31. This piece of information is not that much important. What makes this APP, this one, to turn into this side or this side? What are the factors that turn this to the left or to the right? We'll see. Now, the factors driving APP, this is the father protein, cutting direction. This APP is like the executive manager of a company, like the big boss, to whom the directors of various sectors in the company report. So they report to him how much income they get from each section. So if the income is big, the executive manager, which is the APP, take a decision to expand the company and recruit new employee. However, if the directors of various sections send the messages to him that we don't have resources, so he take decision to shrink the company and fire some of the employee. This is exactly the same principle. So if the brain cell receives nutrients, the receptors report to the amyloid precursor protein, the father protein, that we have enough resources and the brain can expand. So it will cut into the two parts. However, if the nutrients that reach the brain are not sufficient enough, it will cut into the quarters, the four quarters of downsizing, reducing the size of the brain cells and shrinking the connection, what we called programmed cell death. And the cells which die from the brain cells are the last hired, first fired. Like if we have memories of today's morning or yesterday's evening and the person gets Alzheimer disease, the connections and the synapses that carry the information from the previous hours are the first to get fired and die. Now, so we know that nutrient deficiency will lead to formation of the four quarters that lead to downsizing and damage. Also, chronic inflammation lead to the same process. Now, this is the link between the gene, the ApoE4 gene that we mentioned before, and the amyloid beta, the protein that precipitate in the brain. We know now that the ApoE4 is the gene responsible for non-resolution of inflammation. It prolongs the inflammatory process. And when there is inflammatory process in the brain, this APP will cut into the four quarters. So two things can make this amyloid precursor protein, or APP, cut into the four bad quarters: the nutrient deficiency and the chronic inflammation. So now these are the mechanisms that has been discovered by Dr. Bredesen, that we have receptor in the brain cells which is sensitive to chronic inflammation and sensitive to the amount of nutrients that reach to the brain cells. If the nutrients are deficient, or if the brain has chronic inflammation, this receptor APP will cut into the bad direction. Now, it has been found by Dr. Bredesen that this amyloid beta protein is an important antibacterial, antiviral, antifungal. In other words, the brain make this protein from this APP in order to stick to the bacteria and the virus and the fungi that reach the brain, to protect the brain from its effect. That's why the medications that currently use the monoclonal antibodies to remove this amyloid beta from the brain, it will be harmful on the long run, because you are removing a protective mechanism of the brain. So the treatment should be how to prevent the formation of this amyloid beta before it happens. In other words, how to make this amyloid beta APP, this one, how to make it shift to this side, not to this side. This is the secret. This is how to treat the disease. Now, it has been found that the amyloid beta, after it forms, it acts like a vampire. We'll come back here. This is amyloid beta. When this amyloid beta happens, it go to the APP, the father protein, and force it to cut into this direction, to cut into the four parts in order to make more amyloid beta. So presence of amyloid beta in itself will create more amyloid beta. This is the mechanism how, when Alzheimer disease starts, it continues to deteriorate, because amyloid beta makes more of itself. So the process will continue. We need to cut this cycle, to stop cutting this amyloid precursor protein, this one, to this direction. We needed to cut in this direction, because if it come back and cut in this direction, the brain cells will grow again. And this what has Dr. Bredesen proved. Now, in summary, the risk factors that brings Alzheimer's disease are chronic inflammation, trophic support, mean the nutrients that reach to the brain, decreased energy, we'll talk about this later, and toxins, because toxins also create chronic inflammation. And Dr. Bredesen found that there are all these risk factors are approximately 36 cause. 36 cause can lead this APP to go into the bad four quarters. What about holes? 36 holes. He give an example, like if you have roof in the house, and this roof in the house have 36 holes in it, and it's raining. So he has been found that the causes of Alzheimer's disease, or the risk factor number, is not more than 36, probably little more. So we need to identify these 36 holes or 36 risk factors and treat them to close these holes. Once you close these holes, this amyloid precursor protein will shift to forming the two sides that create healthy cells, healthy brain cells, and healthy connections. Also, he found that it's not necessary to treat the 36 cause, and most of the people who have Alzheimer's disease will have an average between 12 and 20 of these 36 causes. So suppose that a person have 20 risk factors. The other person will have another 20 different from this 20, and the third one has 20 other from this one and this one and this one. So by identifying these risk factors that differ from one patient to another, we need to make a personalized approach, because each patient is different from the other. And also, in order for this APP to shift from this side to this side, you don't have to treat all the 20 risk factors that you found out of 36. If you treat 10 or 12 out of these 20, this switch will shift to the good side. So you don't have to treat all the risk factors. You need to treat as much as you can from these risk factors. Now, Alzheimer's disease is not only one type. I will give you example as per Dr. Bredesen said. When somebody has fever, when he go to the doctor, he say to him, "You has fever," and that's it. No, he say to him, "You has fever due to tonsillitis, due to chest infection, due to malaria, due to abscess, due to kidney infection." So there is nothing called you have fever. Exactly the example is typical of Alzheimer's disease. We cannot say to the patient, "You have Alzheimer's disease," and that's it. We need to know Alzheimer's disease due to what. These are the things that we will identify now. So it has been found that there are main 4 types of Alzheimer's disease in addition to 2. I will mention why I separate these 2. Type 1 is the inflammatory type, when there is brain inflammation. Type 2, when there is deficiency of the nutrients of the brain, like the hormones, the vitamins, the minerals. And we will specify which hormones, which vitamins, and which minerals. The third one is the toxic presence of toxins that reach to the brain. So there is another one, they call it 1.5. There is 1 inflammatory, 2 atrophic. The 1.5, which carries characteristics from the inflammatory type and carry characteristics from the atrophic type. That's why Dr. Bredesen gave it the name type 1.5, which is insulin resistance and diabetes. Why this? We will see. I will explain all these in details in the next coming minutes. Then number 3 is the toxic type. We have organic toxins like benzene, glyphosate, and inorganic like heavy metals like mercury and pollutants. And biotoxins, the toxins of microbe like trichotheceans. I will come to this later in details after a while. Then come the number 4, vascular, which is due to presence of hypertension, recurrent strokes in the brain, and the traumatic after, for example, head trauma in car accident. The first thing that happen after traumatic brain injury is precipitation of amyloid beta. So these are the types of Alzheimer's disease. So when you go to the doctor and he say you have Alzheimer's disease, or somebody you love have Alzheimer's disease, you need to know what type of Alzheimer's disease he has, because there is treatment. Now we need to go into various types in little details to explain the causes behind the development of Alzheimer's disease, explaining the risk factors in details. But to this point, I don't want the presentation to be too long. So if you are interested to know the rest of the information, you need to follow in the next section of the presentation. If you like this presentation till now, please like and share in order for this information to reach to other people. Thank you for listening.